Welcome to another live session with me, Vinod James. How are you all? Welcome to Neethus Academy, Reading Live with me. Hope all of you are enjoying your day, having a lovely time as always. Is it? Are you all enjoying your lovely day? Yes, I'm sure you are. We always have a lovely day because we always want to come in front of you. So what else could we ask for, isn't it? That's the most amazing thing that anybody can ask for. Coming in front of all those lovely people who are across the globe, who are there to support us, who are there as a family with all of us, joining hand in hand for everything that we do. Thank you very much for being such a kind of patrons for Neethus family. Jobita, good afternoon. Pramila, good afternoon. Good. So, Uttam Kumar, good afternoon. A very, very, very good afternoon to all of you. But if you're from any part of the world, a very good morning, good afternoon, and good evening to each one of you. Siminibu, good afternoon. Christina Varghese, good afternoon. Softy Stephen, good afternoon. Manija Bipin, good afternoon. Right, as students are pouring up, what are the things that Neethus Academy has in store for you? We have an array of linguistic exam trainings that we do. So if you want to know more insights about it, please do not hesitate to contact the number which is on the screen. Monica Vegas, good afternoon. And as you can see, our next regular batch is only from Jan, Feb, and March. That's how much of a trust the students has with us. Now they're ready to wait. They want to get a more professional approach because they trust us. That's the most important thing, because they always feel that we can be, or we can make that significant change in order to make sure that they reach their dream. Of course, in order to make that change, we make you go through a number of things on the aspect of coming out of your comfort zone. INR Rajanish, good afternoon. Blessings Career, good afternoon. Tansi, good afternoon. Rosmi, good afternoon. Sanita, good afternoon. Susama, good afternoon. Excellent. So if you want, not that we only do regular batches, but we do have crash courses available. So you're always welcome to pop in at anything that you aspire for. We have all those things that is there for you to grab if you require a professional approach. Ambelia Jimon, good afternoon. Kalei, good afternoon. Shalini, good afternoon. Kalei from Maldives. I do remember a few of your places because it kept on, like repeating. So, Anjana, good afternoon. Rinsi Baiju, hi. Shakila Banu, Saudi, good afternoon. So, is there anybody who's attending the live for the very first time? If so, please do let me know that you're attending for the first time, and also would be happy to know where you're from, if it's okay with you. Shirley Charian, good afternoon. Prabha Job, good afternoon. We have just pinned the few channels and the few programs that we have with the Telegram pages and all. So if you have not yet joined, all those things are for you to get the free access. Okay, now why free access? Okay, because there are students who have been contacted by a lot of fraudulent people saying that you pay. No, we do not message you. If they message you, that is, of course, you can consider them as spammers, or they are there to rip your money. So that's why I have to say this, that it's all free of, free access. Shibu Samuel, good afternoon. Kavita Vijayan, good afternoon. Prabha Job, first time. Thank you very much, Prabha. So first person to tell that you're here for the very first time is Prabha, Saudi. Okay, lot of students from Saudi. Josina Joy, good afternoon. Second time, thank you very much. Very kind of you, Josina. May I know where you're from, even though the second time I can't remember where you're from. Divya, good afternoon. So why I keep on reminding it's free access, okay? So please be aware of it. There are n number of fraudulent people available because it's an online platform. They're there, to get that free money because they don't know how to work hard, or they want to make sure that they rip somebody else's money. Cotton, okay, fair enough. So Josina from Cotton, okay, fair enough. Shai Jukuriakos, good afternoon. Merly Joseph, hi. Ajesh John, hi. So there are few names that there is no icons, but almost all the names have at least one icon next to you. That shows that you're all there supporting us with every possible way. You can have a heart sign, you can have a flag, you can have a man icon, you can have a share icon, you can have number one icon, you can have anything, hand. As long as you're there, that shows that you're there supporting us. So we would appreciate your support only. Because if you can really look into our Telegram page, we have about 50K students and counting. That shows the number of students who are actively involved with us on the aspect of making sure that they are benefited when they join us. So if you Ajish after 1 week, okay, fair enough. So likewise, Rishika, good afternoon. And if you really look into our the very same page that you're watching, you can see the number of likes, the number of followers have always been increasing on a daily basis. If you look into our channels, the subscription have always been increasing, and even with the share that you do. See the very same link. If you feel that my classes are going to be beneficial for you, or do you think it is beneficial, and you think that it can be beneficial for someone else, please do not hesitate to share the link, because sharing is caring. And also the number of shares will decide that how many number of students feel that my classes are beneficial. Kajal Anugrah, good afternoon. Reba Reggie, good evening. Shine Johnson, good afternoon. Soni Raju, good afternoon. Anita Prabhu, good afternoon. So as you can see, Neethu Madam will be coming tomorrow. So please do clock in the very same page at the time. You have to always keep a reminder, 10 p.m. Indian Standard Time. Okay, do keep a reminder. We'll all be waiting for you. Right, see, we do try to give you whatever that we have. Every time she comes up with a new self-prepared case note that will always enhance you on the aspect of giving a wide array of thinking. What are the possibilities? What can you write? How can you write? That's how you learn, isn't it? Learning is a process where you make mistake, you rectify those mistakes. And if you're aware of it, be happy. If you're unaware of it, again be happy. Why? We are there to clarify. So if you're unaware of something, please do not hesitate to clarify, which I've been telling my students. See, it doesn't matter what you feel about. I'm afraid, he's rude, nothing. If you want, because you have all the liberty to clarify, isn't it? You are here with the purpose of learning and making sure that you reach your dream. Anita Prabhu, good afternoon. Neethu Jose, good afternoon. Anna Saju, good afternoon. So very, very, very good afternoon to all of you. So as you are all there, two people said that, sorry, one, Prabha said from Saudi, and what was that? Forgot. Josina from Kottayam, yeah. Kalei, how am I? I'm doing good, Kalei. Thank you very much for asking. I hope you are enjoying a lovely time in Maldives as well, with pristine water around you. Yeah, good enough. Right. So this is the love and affection that you all have for us. So it's highly appreciated. So are you all ready for today's session? If so, give me a quick thumbs up and say, yes, I am ready. Or you keep on saying, just put a thumbs up. Yes, are you all ready for today's event? Because we'll be doing two things. One, a part B, where the question will be popping up on the screen, and the other one is a part A, which I've already shared in the exclusive reading Telegram page that we have, and also on the very same page that you're watching, and also with the latest addition to Neethu's family, the WhatsApp channel we have shared. Sunu Hanu, good afternoon, new name. Rishika Reddy, Swapna Reddy, Manisha Reddy, Simi Reddy, Ambili Reddy, Jobita Reddy, Nintu Reddy, Shirley Reddy, okay, fair enough, Anjana Reddy, Tansi Reddy, Asha Seben Reddy, Sneha Ashish, good afternoon. Shine Johnson Reddy, Sunu Hanu Reddy, Sneha Reddy, Lisha Marine Thomas, good afternoon. Right, so as you all said that you're ready, Kavita Vijayan is ready, Blessie's career is ready, Pramila is ready. Pramila, I hope you are from Cool. Is that one of the very beautiful places? It's called Switzerland, is it? Of India? Excellent. So as you all are ready, Now, let's go and have the material on the screen. The material will be popping up, and as soon as the material pops up, do not waste your valuable time. Just find an answer. Once you found the answer, don't write the answer. Just put a thumbs up or just say done. I'll ask you when to type the answers. Yeah. Lisha Mariam is ready. Sanita is ready. Pramila, yes. Okay, fair enough. I was just having a bit confusion, but I thought, yeah. Fair enough. There you have the material. Please do the material and then we will discuss. Right. I'm so happy to see at least, like a lot of you have said done, 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 done. I'm not talking anything about the material, but it's about that attitude that you have. That was so nice to see that all of you have done. Even as soon as it was about a minute of time, you had made in exam. This is also another reality you have to accept. Right? There are questions where you can get it easily. So do not waste your valuable time. Just go to the next one. Okay, this is how you manage time as well. Fair enough, Megha, Jayar, good afternoon. So as you've all said done, 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 done. A lot of people have said done. So good enough. And as I've always mentioned on my everyday life, it's about the enthusiasm that you all show in order to take part. That's the most commendable thing. It's the absolute recommended or recommendable thing for each one of you. Now, as you all have started to say the answers, Rashmi Molmanos, good afternoon. May I know what is your answer and where you got that answer from? B, 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 B. I could see a lot of B. Yeah, fair enough. Everybody is saying B from the whole para, is that? Okay. So, Self-Kumar, good afternoon. Sorry for being late. Fair enough, no worries. So, I'm not able to, get into it because Rishika, Jobita, Swapna, Selva, Softy, Anita, Sumi, Milu, Shakila, Aina, Shirley, everybody. There's only one unanimous answer as of now. As I've always mentioned, don't worry about what others are saying. Whatever is your answer, it's your job to comment. Shirley, Suzamma, Melby, Softy, Swapna, Neethu, Anjana, Shalini, Soni, Sanita, Uttam, Simi, all are saying B, 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 B. Okay, good enough. So because there's only one unanimous answer, let's see if it is right or not. I've never told you whether it is right or not. Now let's go back and see what is the material and what is it to, how to do. See, when you're doing part B, the first and foremost important thing that you have to really look into is read the question, understand the question, underline the keywords in the question. Very, very, very important. Okay, Selva saying C. Okay. Now, what did I tell you? The first thing to do is read the question, understand the question, underline the keywords in the question. See, key words means it should be word. So the paragraph do you need? No. What is the information? That is the only thing that I need, because the other thing I can always understand. So see, now how would you reduce your keywords? Okay, see, these are all talking about bronchodilators, isn't it? Each one of the questions have bronchodilators. That is a very common thing. And the heading is also bronchodilator. So do I need to underline bronchodilators again? No need. First one, type. Second one, uses. Third one, definition. That's enough for me. Okay, but generally when you ask a student, what are your keywords? Definition, bronchodilators. Do you really need that? Uses, office, something that they eliminate and say, okay, this is not needed. Okay, there are a few C coming up now. Manija B, Anita C, Aina C, Mega B, Kavita B, okay, Ambili B. Now let's see. Okay, now what is the question? What is it talking about? The whole, what is it giving you information about? Whether it is a type of bronchodilators, or is it the uses of bronchodilators, or is it the definition of bronchodilator? See, a bronchodilator, you are not supposed to miss anything. A bronchodilator is a substance that dilates the bronchi and the bronchioles, decreasing resistance in the respiratory airway and the increasing airflow to the lungs. So what are they saying? A bronchodilator is something that dilates bronchi and bronchioles, decreasing resistance, increasing airflow. So bronchodilators may be indigenous, originating naturally within the body. So it is something that it is already there within the body, or there may be medications administered for the treatment of breathing difficulty. So it can be within naturally, or it can be infused into your body. They are most useful in obstructive lung disease, of which asthma, chronic obstructive pulmonary disease, COPD, are the most common conditions. Although this remains somewhat controversial, they might be useful in bronchiolitis and bronchiostatis. They are often prescribed but unproven significance in restrictive lung diseases. Now, any types of bronchodilators mentioned? Not mentioned. So, eliminated. Definition of bronchodilators, there is nowhere it is giving any definition as such. It is just telling you what are the uses of it. Not just about one particular word. That is where you are referring, because you're trying to refer the keyword. Okay, definition. Definition means it can be explanation. No, it's not about that. What is bronchodilator? Bronchodilator is a substance. Okay, they're saying the uses of bronchodilators. In order to do that, they have said it dilates these two. What are this? They're doing, what is the uses? Which in turn decreases the resistance of respiratory airway, increase airflow. Then on top of that, they are saying bronchodilators may be indigenous. It's not the types of bronchodilators. They are saying it can be within the body or it can be infused. That's all. They're most often useful in all these. So again, all these things are the usefulness or the uses of bronchodilators, isn't it? Although it still remains controversial, they might be useful. Again, they're talking about the uses. So everything is about uses of bronchodilators. A very straight answer, but happy that you've got. Most of you have got. Soni Raju dancing, Tansi enjoying, Rishika dancing, Jobita happy, 𝗓𝐶𝐶 news, my dear. I'm not very, very familiar with all these and all, but yeah, as long as you're enjoying it, please do. Softy happy, Pramila dancing, keep on dancing. So much surprise, is it? That you got the right answer or you got the wrong answer? Ambali is dancing. Excellent, good enough. Kale is dancing. Good, good, good. Keep on and cherishing your achievement. Whether it is small, big, doesn't matter. You have to enjoy. Good. So, although I would say the answer was a bit straight, I'm not saying easy, but I would say straight. To enjoy. And that's the reason why we can go to the next one. What is the next one? The next one is called Part A, which we have already shared, isn't it? We have already shared. And even though the length of the heading is quite long, but still. Cavernous sinus thrombosis. Okay. So now the next question is how you felt about today's part A. Now, how is the important thing that I need? Because I'm always a person who always believe that you are all people who gets the right interpretation on the aspect of how it can be done. Yeah, how you felt about it. So that you was very, very important for us. Easy. Generally, the answer is coming as easy, easy, easy. Okay. Shaheen is also saying the heading. Softy is saying the heading. How you felt? Shakila is saying easy. Jobita easy. Kalai easy. Softy easy. Tansi easy. Rishika is a, generally the past few days you're getting easy material. Selva is a, Rosmi is a, Susama is a. So part A is also easy and part B was easy. Yeah, good enough. Swapna is a, Shirley is a, Blessy is a, Pramila is a. So next time when I go to Coorg, I have a person who's already there in Coorg. Good. Good enough, good enough. Anshu Roy is a, right? Anjana, little tricky, okay, fair enough. See, the whole purpose of why we, when we do these materials and all, okay, when I do the material, I always feel that there is always something to learn on an everyday basis. There's always something to learn. And if you really look into the perspective of learning, it can be a word. Okay, there are n number of things that you can use as what you can say, synonyms or whatever. So what are the things that we are going to do in part A? See, the first and the foremost important thing that you have to understand is part A is a material that you're going to only see for 15 minutes of time. That's it. They will place the material, do not touch. When they tell you to start, touch the material as quickly as possible. Start reading, because you have to tackle 20 questions. So what's strategy? As soon as they tell you to start skimming. That's a strategy. Skimming means quick look, scanning means detailed look. How much of a time to do skimming? Generally, I say 15 seconds per text. And as when you're skimming, you should know the difference. See, these are all small text, so you can skim a bit more quickly and then go to the one. Maybe there might be a long one, we don't know. Okay, don't waste your valuable time. Every single second is important. So 15 seconds, that means that when you're skimming, you should know what is the difference between text A, text B, text C. Because why I say text A, text B, you have 4 texts which will be based on one common theme. Each text will be different to each other. So if you can differentiate that, okay, text A, I underline few of this. What are these? Okay, this is about this. Text B is talking about diagnosis. Text C is about the prognosis. Text D is about management. Okay, fair enough. Done. Okay. Now let's see how to skim. So what are the keywords? Keywords, okay. Heading is always a keyword. Subheading is a keyword. Letters given in bold letters, italics a keyword. Numbers a keyword. Proper nouns a keyword. Any new terminology, especially with disease condition, signs, symptoms, machinery, devices, equipment, all those things are supposed to be your keyword. So keep on underlining. Don't search for the keyword. As you skim through, go underline it. Do not worry about whether it is keyword or not. Just keep on underlining, because you have to know what are the keywords and it automatically comes to you. Time management is something that students always have a problem with, because they simply waste a lot of time whether to see whether am I underlining keywords quickly. See, the first and foremost important thing is about practicing, genuine practice. So what do? Take a material, keep a timer. Okay, then start skimming. So just I'll show you how to skim. So as you read, don't read word by word. Skim through means quickly read. So carnivore thrombosis, right? Potentially life-threatening blood clot with carnivore sinus is located behind your eyes, behind vein, multiple veins, including venous or blood veins, or carnivore sinus. They drain from the red brain and the face, or brain and face, and cold blood forms and organ what's restricting blood flow. Carnivores cause long-term damage to the brain, eye, nerves, and which forms the treatment to death. The carnivore thrombosis, but the factors may play a role. Carnivore thrombosis, serious condition with death, 30%. So I'm done. So initially they're talking about lots of veins, they're telling eyes, brain, this is where it gets affected, it's a clot, 30%. So then subheading, diagnosis. So anything with regards to diagnosis, you go to text. This is how you do. So imagine MRI, CT, MRV is there, bacteria, cultural test, spinal tap, lumbar puncture. So then you go, provider will begin with antibiotic treatment through IV. So this is all going to be talking about all the treatments, isn't it? Treatment is time sensitive, anticoagulants, corticosteroids, sinus surgery. Then they're talking about thrombus location and symptoms. So this is the relation between these two. They're talking about, see, this is the table. Rows and column headings are important. After that, we're going to go to the question. Okay, when you go to the question, as I mentioned, there are 20 questions where it is divided into 3 types. This should be by-hearted by each one of you. What are the things? 1 to 7, these are called match the following question, where your answer should only be any of these letters, either A, B, C, or D. That's it. So you may use any of these letters more than once. That's how 1 to 7 is. You should by heart this. As of now, this is how the pattern. So after this, you're going to underline the keywords in the question as well. So which method is most sensitive to diagnose? See, do you really need an answer? I would say method, test. Where are they talking about? Diagnosis. Which needs? It is more sensitive imaging producing test. So is it mentioned like that? Yes, it does. So test is there. It is there. Understood how you refer keywords? Now, signs usually associated with cortical vein thrombosis. So where are they talking about signs? What do they see? Go to D, isn't it? D here. So what is the signs of cortical vein thrombosis? So here it's cortical. What are the symptoms? It's there. So the answer is D. Understood how keyword reference are very important. Next one. Prevalence of mortality rate. See, there is only one place where a mortality rate which says 30% when I skimmed. It is there in A. So mortality, it causes death up to 30%. There you have the answer. This is called the power of keywords. Link between the site of thrombosis and symptoms. So again, D, isn't it? Thrombus, symptoms. That's talking about the heading. Thrombus location, symptoms. Straight. The answers are very, very easy to find. Now 5, drugs that have to be taken several months after initial treatment. So drugs after initial treatment, do you really need a second thought? It should be there somewhere in C, isn't it? Yes or no? Yes, it should be. Why? Because it clearly says you may need to take anticoagulants several months after your initial treatment. So the answer is C. Now, how do we manage swelling causing pressure in your sinus? So again, something to do with swelling, and also it has to do with some treatment, isn't it? So what is that? Your provider may prescribe steroids to reduce the inflammation. So that is it. The answer is C again. So both are C. What are the functions of cavernous sinus? So functions, A. That's where this word is most came, isn't it? So I've wrapped 1 to 7. How easy, isn't it? Now please be kind enough to tell me what are your total scores. In the meantime, just give you some insight about the next set of questions. These are called short answer question, where this question number starts from 8 and ends to 14. Okay, so these are called short answer questions. Let's say 7 out of 7. Good enough. The answer can be as simple as that of a word. Shakila 7, Sharon 7, Softy 7, Susama 7, Thansi 7, Kalai 7, Rishika 7, Soni 7, Monica 7, Sanita, Mary Joseph 7, Anjana 7, Pramila 7, Ansu 7, Jasmine 7, Jobita 7 out of 8. Okay. Molly 7, Sanita 6, Shine 7, Megha 7, Selva Kumar 7, Shalini 7, Priya 7, Ambali 7, Shirley 7, Swapna 7, absolutely good enough. Keep it up, keep it up. Sneha 7. Right, so the instruction is very important. So short answer question, answer can be a word, it can be a number or numbers, or it can be both word and a number or a short phrase. Okay, so things doesn't change. You're going to underline the keywords and then you're going to purely refer. Please do not go behind meaning. Don't look into the aspect of, okay, it can be with that and all those things. No. Betsy 6, good enough. Atira 7, Selva Kumar, Neethu 6. Okay, fair enough. Now, which procedure make use of contrast dye into the veins, enhance blood flow during MRI? So MRI, where? Only one place MRI, is it? Isn't it? MRI is only mentioned one. Now the next thing is about some dye. So during MRV, your provider will insert a contrast. So what is the answer? The answer is MRV. Even though the abbreviation is mentioned, but you really don't have to worry about. See, it is not with venogram and all those things. No need. MRV. That's it. Okay. Try to make the most out of the time that we have. Of the various veins that transverse through the sinus, Which one is deemed essential or critical? So vein, I know that there are multiple veins. So which is the vein? Jugular. So which is the vein that is jugular? Sorry, which is the vein which is important? It is jugular vein. Jugular. See, because multiple veins are there, but this is one specific vein. So even if you write vein, it's not a problem. So jugular or jugular vein is the most appropriate answer, even though veins are there. I'm not saying no. Okay. Next, one of the complications of cavernous sinus thrombosis whose spreading can be identified along the infection through lumbar puncture. So lumbar puncture, go straight to B. Why lumbar puncture is there? Now, one of the complications. So what is the complication? Meningitis. meningitis. Excellent. So who are responsible for the clot formation in one of the veins, okay, which turns restrict blood flow from your brain? So which is the causative one? So who causes it? So this helps drain the blood from your brain and face. If a blood clot forms in one of these veins, often in response to an infection. So the answer is with or without the article. An infection also fine, infection also fine. Next, how is the initial antibiotic treatment administered to address infection responsible for the clot? So initial, that means the first thing, how are they going to administer? They're going to administer how? They're going to talk about, they're saying they're going to administer through IV to clear the infection that causes a clot. So simple, IV. An anticoagulant that both thins the blood and dissolve existing clot while preventing the formation of new clots. So the answer should be from, again, C, isn't it? This is how you refer with the keyword. So anticoagulant is only there. Now, you may need medicine that thin your blood like heparin to dismantle the clot and prevent. So thinning, dismantling, new clot. Everything is there. So the answer is heparin. Heparin. Good enough. What is the location of thrombosis that can lead to the development of intracranial hypertension and seizures? So where are they going to talk about this? It should be definitely there in, because the location is there. Why? That is where the location of thrombus. So it's there. Now the next one, intracranial, okay, seizure. Next one, yes, seizure is also there. So what becomes the answer? The answer is, so sagittal sinus, sagittal sinus, sagittal sinus. Excellent, good enough. Now for the next set of questions, 15 to 20, these are called fill in the blanks question, or at times they are called gap fill questions. Anything is open. Okay, but I would definitely stick to fill in the blanks. Why? That's something that we have learned throughout, isn't it? So the answer is very similar to how the instruction is very similar to short answer question, word, number, numbers, both short phrase. But here, article redundancy is considered to be wrong. Even a word is already mentioned, then it should be wrong. So be aware of it. In dash, your provider inserts a needle onto your lower back, collect the sample of spinal fluid, analyze for bacteria and other indicators of infection. So where are they talking about? So it should be there somewhere in the diagnosis, isn't it? So infection spread in your brain, meningitis during the procedure, your provider insert during the procedure. So what is the procedure? You can write two ways. Lumbar puncture also fine, spinal tap also fine. Either one is okay. Already you have already written it. Okay, fair enough. Question 16. Dash are developed from thalamus lesions. Thrombosis located in deep venous sinus. So where are they talking about all these problems? It should be problems are where? Problems are in D. Now what are they? Things that you have to look for. Now thalamus lesions are there. Deep venous also there. So what is the only thing which is missing? Behavioral problems. BEHAVIOURALPROBLEMS. Excellent. Steroids are used to reduce inflammation causing pressure in your sinuses, often succeeded means, see, students have always this problem. Succeed and proceed are two different extremes, or succeed means precede, two different extremes. Even though it sounds same, the meaning are two different ways. So here it is succeeded. So what is succeeded? Succeeded should be there in text C. Why text C? Maybe due to inflammation, because I know I have already, if you receive them after antibiotic treatment. So what is the thing? What is succeeded by? Antibiotic treatments. ANTIBIOTIC Excellent. Unilateral or bilateral dash along with intracranial hypertension, seizures could be seen. People who have trouble with thrombus and sagittal sinus. So where are they talking about? It should be there in D, isn't it? Now, unilateral, bilateral, intracranial, seizures, sagittal. So what is the thing? Motor deficits. MOTORDEFICITS. Question 19. As treatment is that antibiotics may be needed to prescribe prior to the confirmation of infecting pathogen through diagnostic tests. So where are they talking about? It should be there somewhere in C. Now, providing with antibiotic treatment through IV clear the infection that causes the clot. Treatment is time sensitive. It's a hyphenated word, so please ensure that you're writing it with hyphen as well. Time hyphen sensitive. Okay, without hyphen, then be cautious. Dash are located behind your eyes, brain, clot, causes life-threatening carnivorous sinus thrombosis. So it should be definitely somewhere in A, isn't it? That's the first thing. So where are they saying? It is your carnivorous sinus are located, your cavernous sinus are located behind your eyes, beneath your brain, all those things are as such. It's CAVERNOUS Excellent. So I have wrapped my 20. I'm sure that all of you have wrapped your 20. If there is any doubt with regards to any of the question, please be kind enough to clarify. If not, do shoot me your total score. Softy 20 out of 20. Absolutely good enough. Excellent. Good enough. Jasmine 20, excellent. Rosmi 20, Susamma 20, very good. Selva 19, excellent. Keep it up. Jobita 19, excellent. Keep it up. Shakila 19, 𝐵LESSY 20, Pramila 19, Murli 18, Arya 18, Sneha 19, excellent. Keep it up. 20 Swapna, Rishika 20, Megha 20, Anjana 18, Ambali 19, Ansu 19, Sanita 18, Nancy 18, very good. Keep it up. Good. So happy to read out all your lovely scores. Kalai 18, Mary Joseph 19, Shalini 19, Betsy 18. Very good. Keep it up. Good. Shakil has already started saying thank you. Monica Vegas 20. Is there anything that you want me to clarify? Anything that you want me to address before we end up today's session? Suzama, thank you. Uttam 20. Very good. Anjana, thank you. Anything that you want me to clarify? Cheryl 18, good enough. Milu 20, Softy, thank you. Ambali, thank you. Rishika, Pramila, thank you. 𝐵LESSY, thank you. Jobita, Kalai, thank you. Selva Kumar, thank you, my dearest sir. Ansu, thank you. So Priya Chiku 19. So as you've all started saying thank you, it's high time that we also say thank you so much for the lovely participation that you're all showing to us, the trust, the participation, the love, the care that you all show to us. So we would definitely keep all those things to the highest level, and we always believe that it is because of you we are also in here. So whatever that we are doing is all because of your valid feedbacks, valid participation, valid support. So please do support us in the very nominal way that you could. Just click the share button, just like the page, subscribe to our channel. That's all what we expect. So unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.